So we're going to be continuing with a series of questions to ensure that people do not end up with breast cancer. We are going to be looking at, now the symptoms and the signs when you actually have breast cancer. Is it that it usually comes at a particular period where you can literally be feeling pain on your breast and you feel like it is breast cancer, or there's a particular thing that you will see or that you will feel to know that it is breast cancer?
Before I get to that question, I must comment on two things I cannot let go. First of all, you talked of calling for your girlfriend, mother, sister. You did not mention wife. You don't want these brothers to have wives like us.
I'm sorry.
I'm offended too.
I'm very sorry. Please, for your wives too.
Well, let me
for your wives too.
Number two, I'm not solving anything in the studio. I like touching breasts. You will come, I will touch it.
Exactly.
And feel satisfied and say it is okay.
Yes, that is so. It is always a good thing.
So just an aside, But what I want to say is that no matter how much of your questions is being answered here, it's always good to go to the hospital and get views, because you might say some certain things and you might not say some certain things. Maybe because you're shy, or maybe because you don't even know that you're supposed to say that particular thing.
Yeah, and she was talking about actually going to the hospital, because she could actually answer something here, or for you coming so she can literally feel it, because feeling it is different from hearing what is wrong with you. So yeah,
and when I feel it, you feel satisfied and good.
Yeah, and you definitely know that you're fine now and you don't need a hospital, or you need a hospital. Definitely.
So when it comes to the signs and symptoms, there are very few, but then you don't have to wait to receive all of them before you rush to the hospital. I always say that when you start feeling one thing, it's good to go and confirm. It's better you go and say you're not fine, you're fine, and then you go back home rejoicing, than to sit and wait until you're going when it's already at the stage where we have to say, well, we'll help you to die in peace. Because we help you to die in peace when you've allowed it to reach a point. But then cancer can be treated. That's where I want to start from. So the only way for us to survive is by early treatment.
And early detection is very important.
Early detection. So for the signs and symptoms, first and foremost, we always have lump, mass, or thickening. Sometimes it is painless, sometimes it is painful. It depends on each and every one. But then I would like to also say that you will have lump or breast mass with young girls at the age of puberty. It's very common at that age of puberty. You will have several girls, maybe 14, 15, who has just developed breast, up to even 20, that will feel an abnormal mass on the breast. Sometimes it's normal, but it's always good you come and we confirm the normality before we say you can go back home, and let's observe and see. And if they give you a follow-up, make sure you do the follow-up as requested, because at some point if you go and sit and it gets to something else, you might not maybe see that it's something else already, and you will sit comfortable because we said it's fine. And
does it mean that some of these signs and symptoms are the ones that are actually silent?
Yeah, some that are very silent.
Oh,
yes. Then that's away from lump, mass, or thickening of the breast. We have changes in the size of the breast. Like I earlier said,
increases
there are
or
some that can
reduces.
Increase and there are some that will reduce. And so you might even notice that your breast is instead drawing back. You don't understand what's happening. My breast is reduced.
There are even people that are advocating for bigger breasts, and you notice that your breast starts reducing instead of increasing.
And yes, I have to go to the aspect of that breast enlargement stuff. Please, those are already abnormal growth of breast cells. Do you know what you're advocating for? You're advocating for cancer. I'm sorry to say. Feel beautiful with those small oranges that you have on your chest, because there are some of us
healthy.
I'm telling you, you don't know what those chemicals they are applying on your breast, or you're drinking. You don't know what those chemicals are made of. You don't know their composition. You don't know how the after effect. You're just you're just obsessed about the now and now. But you're forget. At first, when my breast was still growing on, my mother almost wanted to do breast ironing. I was like, hey,
That was very common in
that
those
was very
days.
common in those days because they didn't want us to
Have heavy chest.
yeah, but instead
We
now
believed.
it's something else.
No, girls of
Please.
nowadays they don't believe in small breast and whatever.
Well, it's about
It has to
confidence
be-
and self-esteem.
Yeah,
Maybe you have to
definitely.
hold something about that, but it's very important. Yeah.
Okay.
So a lot is happening, and maybe it's also societal stigmatization and all of that. So that abnormal growth of breast, those products you use on your breast without, it's very dangerous.
Okay.
So when you notice that your breast is changing in size, especially one is bigger than the other, at some cases it's normal for the breast not to be the same.
Yeah, I
It's-
know a
it's-
lot
it's
of people
normal.
who have like
Yes.
the right side is always bigger or the left
Yes.
side. It depends.
Yeah, like some I noticed of recent that geographical location also matters, because in August when I was in Oku for a screening campaign, I noticed that most of the women had one breast larger than the other, and it's
Okay.
normal. It's
Yeah.
normal. It's not a problem. The only
How do you explain that though? How can? Why is it even like that?
that's
Nature.
creation.
Okay. Yeah,
So,
but it's normal. There's
it's
nothing to
normal.
worry about.
But now, if your breasts have always been in a particular way and you notice changes, it's a call for concern. Don't sit home and be happy about it.
That is why people are always supposed to, like, every day you wake up, as you're in front of the mirror, always know the size of your breast.
Yeah.
So when your breast starts increasing or decreasing, you will be able to determine that something has changed.
Yeah. Then the next thing is abnormal discharge of the nipple. It could be bloody, it could be yellowish. When you see any abnormal discharge in the nipple, it's a call for concern.
Okay.
It's okay if it is maybe milkish or watery, look like clay
Okay.
in color, but then when you see it already abnormal, yellowish, greenish, or bloody, it's a call for concern.
Okay.
Another one is the retraction of the nipple or nipple redentation.
It goes inside.
Yes, you see the nipple
Wow.
going inside.
So I literally just seen breasts, no nipple too present.
That's it. So
Okay.
at some point, instead of, if your nipple used to be pointing and then at some point you see it drawing in, it's a call for concern. Those
It
are
still,
already
it still
signs.
goes back to the fact
Yes.
that you should know your breast.
Yes.
Know your breast.
And another one now is mass at the axillary.
Okay.
You just find something growing at your armpit,
Okay.
because breast tissues actually extends here.
Okay.
Yes.
Okay.
But at some point the growth will not even be from the breast itself, breast tissue. It could be the breast, the it must have been metastasizing and it's affecting the lymph node here.
Yes.
And when it start affecting lymph nodes, it's already dangerous.
Getting serious.
Yes,
Okay.
it's getting serious. So also orange skin, as I had mentioned earlier, is also a sign and a symptom.
More like goosebumps on your breast.
Yes.
It's a
So
sign.
those are the common signs and symptoms with the breast cancer. So if you see one or two, it's
Just
good
know
to-
that it is.
yes, just come to the hospital.
Okay.
And
Thank
we
you.
don't just look and we say it is it. No, we will still
Run
have
tests.
to run some exams to make sure that it is, even with a mass, if we see that it is suspicious, we will tell you that we are suspecting but we are not sure, and it's only a laboratory investigation that can confirm.
Okay.
Please, I would like to encourage us, don't just go to any Jack and G in the quarters that is a clinic, and because there are people that have gone and they've incised cancers, they are not supposed to touch that. So you go with a cancer and someone will say it's just a lump, and operate and remove it.
Oh my God.
That's already, what if they go and tag and trigger it and it migrates to other
parts of
yes.
your breast.
So it's not every lump that is to be removed.
Okay.
Until
There's
we
some
are-
that can be diluted.
no, we diagnose first.
Okay.
If it needs removal, then there are surgeons that are particularly trained for it. It's not everyone that can, even me myself, I cannot try it though.
Yes.
to remove
Operating on
no.
a lump in your
It's
breast.
not at all. It's very dangerous. Let me say so.
Okay. I mean, that was still very elaborate, but we have someone here who has sent us a message, definitely redirecting a question to you. It is Cynthia from Obili. This person says, is it true that sucking breast will cure breast cancer? Because I regularly see memes about men offering sucking services Oh my gosh.
I mean,
I've heard it a lot, especially this period. You see on people's statuses, like, come for breast sucking or come for. They're always like, it has actually. There are actually certain posts that suggest that scientists have said men actually or sucking breast literally reduces your risk of breast cancer. Is that true?
well, people have coined a lot of stories. I remember last week in our group chat, in our department group chat, someone sent a video, and it was in China, where they had put some mannequins and then just cut off the area such that if I stand behind and expose my breast, you will not know who is behind. And then men were actually serious on the breast sucking issue, and I'm like, oh wow, this is getting serious. But then I would like to say that they say breastfeeding reduces risk of breast cancer. So it's not breast sucking.
Feeding.
Breastfeeding.
Let's take that again. Breastfeeding.
So there is a difference between breast sucking and breastfeeding.
Okay.
Breast sucking is for pleasure. And I would like to ask our brothers, when you're sucking, do you have milk coming out?
I don't think so. I don't actually think so.
Okay. So you see, I want to maybe explain a little why they say breastfeeding reduces your chances.
Okay.
With breastfeeding is when the breast is being sucked by the baby, the hormone prolactin is stimulated. Prolactin is the hormone that stimulates the production of milk.
Okay.
And now with the production of milk, when it is stimulated, it means that prolactin is increasing in your system, and then the other hormone like progesterone and estrogen, their concentration is being attacked. So progesterone and estrogen can actually, especially estrogen to be precise, can actually speed up breast cancer development. Now when prolactin is being stimulated, the concentration of estrogen is reduced, and when it is reduced, you're reducing the level of concentration and the level of availability of estrogen in your system. That's why women who breastfeed, they have a reduced
lower
chances,
risk, yes,
compared to women that have never breastfed.
So if you've never breastfed, no matter how they suck your breast,
you will still have
breast cancer,
and we will still receive your money.
Okay, thank you so much. And to Cynthia, I hope that they've answered your question. And to the men out there, we're sorry that we are maybe taking breast out of your mouth, but it is definitely not going to make a difference. But if you're a breastfeeding mother, we definitely encourage you to definitely breastfeed your child, because there are so many breastfeeding mothers these days who shy away from breastfeeding their children. They always go for milk options, other options for the baby, not knowing that it is not that releasing of breast milk is not just for the child, but it is equally for you who is breastfeeding the child. It lowers your risk of breast cancer. So we're going to be centering now on our last question for today, which I think is very important. After knowing the risk factors, after knowing the types of breast cancer, and equally the signs and symptoms, it would be good that we equally know if the kind of treatments that are available for breast cancer.
Okay. So before I go to treatment, I would like to also include that before we go to treatment, there must be something that shows that it is already a cancer, and that is screening or diagnosis. And with screening, we always start with asymptomatic. It means you don't present with any signs and symptoms. When you're not presenting with signs and symptoms, it's good to go. You don't go to the hospital only when there is a problem. You go also to ensure that there is nothing wrong with you, and to hear what you can do also to avoid some certain things from coming into play in your life.
That's why they always advise on regular screening, regular checkups, generally for your well-being.
So we have breast examination, as you already encourage here. It's very important you get familiarized with your breast. You're doing breast examination at home is for you to familiarize with your breast. So it's always important, at least once in a month, you as a woman should check your breast. And when checking your breast, you don't just look at and when you stand in front of your mirror naked, admire your skin. The reason why we don't feel comfortable with ourselves is because we don't admire what we have.
Yes, most people do not.
Yes, and when you don't admire it, you will feel disadvantaged. You will feel like you need to do something about it.
That's
Like
when
I,
brush enlargement comes in.
yes, like I for one, I used to have a lot of pimples, and at some point I get depressed about it. But when I used to stand in the mirror and look at myself, I would see myself very beautiful with those pimples all around my face. I used
It's
to
more
cry
about
because it was painful.
self-confidence.
Yes, I used to cry because it's painful. But when I look more in the mirror, I saw how beautiful, no matter how much they were on my face, and I was confident. So it's the same with any part of your body. It's good to admire them. So you check your breast to see the sizes of the breast. You check the coloration of your breast. You check the nature of your nipples. You check the positioning of your breast. You're raising your hands to see, are they rising in the same direction, in the same manner, or one rises before the other. When one is rising before, there's already a change that is happening that is
Yeah,
not.
maybe one is heavier
Yes,
than the other.
yes. So you have to actually take that into consideration, and after that you palpate to see, to feel if there are anything. And when palpating, people always go like this. No, no, you don't do this.
Don't go with your
You
five
don't do
fingers.
this. You go like this. You have to harden your palm such that if there is anything, you can
You
be able
feel
to
it.
grab it.
Yeah.
Because like this, if there is a lump, it can seep here. There are
Yes.
movable lumps and they are non-movable, and they are commonly movable ones. So when you go like this, you are able to feel everything.
Yeah.
And it's always good to palpate when lying down and expose before you palpate.
Okay.
That's it for self-breast examination. For clinical breast examination, it's always encouraged at least once in a year you go to the hospital just to examine your breast.
Okay.
Yes, if there is nothing, they will tell you maybe you come after a year or after 6 months or after 2 years. It's good to go for clinical breast examination. Then we have mammography. Women 40 years and above are being encouraged to do at least a mammography a year.
Okay.
In Western world, it's already a routine.
Now you must do it.
Yes, that you
Something
do
like.
it. In companies, they pay for it.
Okay.
Every year they send the women to go and do their, to make sure that they are healthy while working. And you can take that upon yourself. In as much as it's 30,000 or 35,000, it is worth more than when you have to be diagnosed with cancer and you have to spend hundreds
lot
of
more.
thousands or millions. Maybe if you cover yourself and you budget 30,000 every year to just do a mammography, it's already a good job you're doing for yourself.
Okay.
That's it for asymptomatic. Now for symptomatic, that's you're already presenting with signs and symptoms. We have clinical evaluation. We have to evaluate from our clinical point of view.
Okay.
And then afterwards, we can go in for other examinations like biopsies or fine needle aspiration. It's also a type of biopsy where a tissue is obtained and sent to the laboratory to ensure it is not a cancer or it's something that can be handled in a different way. All of these, they are very important aspects. And the reason why I'm giving this is because I'm not going to go detail to treatment, because treatment is not something we should know.
Yeah.
The most important thing you need to know about treatment is that you can either have a breast remover or a lump remover. That's surgery, that's surgical treatment.
Okay.
You can go into chemotherapy, you can go into hormone therapy, you can go into target therapy and radiations. So I've listed 5, I guess. There is surgery, there is radiation, there is hormone therapy, there is target therapy, and there's chemotherapy.
Yes.
So those are the
chemotherapy.
5, and you should know that you cannot just go. Sometimes you don't they don't use just one therapy. Sometimes they can combine 2 or 3 therapy for
Wow.
it to be a
For
success.
one person.
Yes, for it to be a success, they can combine 2 or 3 therapies. And so it's always very important that when you start the treatment, continue to the end, because that's what guarantees your safety. That's
Definitely.
what guarantees your survivor when
Okay.
it comes to breast cancer.
Okay.
I don't
Thank you so
serious.
much. Thank you so much. I mean, this was a very interesting session. But then again, before we go, because we are already running out of time, I would like to know if you have anything more like a last words for our viewers and our listeners, of course, concerning breast cancer.
Okay, as time has cut us short, I would like to say that in as much as we cannot prevent some certain aspect, there are aspects that we can prevent.
Okay.
Our diet is a very vital aspect. You have to make sure that you keep a healthy weight, you eat the right food at the right time, you maintain great hygiene with your foodstuffs that you prepare in your board.
Definitely.
Also, physical activity is very important. Some people just take into consideration that I'm sexually active, so that's a physical activity. I'm sorry, that's not a physical activity. I'm sorry to disappoint you. You have to get into jog. do some exercises, some stretchings. All of that, they are very important. They don't just prevent the breast cancer. It also goes along to prevent things like diabetes, hypertension, and other non-communicable disease. Also reduce the rate at which you eat canned foods and these junk stuffs out there. There are a lot of unhealthy how can I say it, preservatives that are used on them, and it's better if you can prepare your natural things at home, do it. If you want to eat your pizza, make it by yourself.
Then you would actually know that you put healthy things in it, organic foods
so
by yourself.
It's we can actually prevent cancer.
We can definitely do so.
We are fighting to prevent cancer, and you are not left behind. You just have to go in for the act, and let's join hands and end this deadly disease.
Okay, thank you so much. I mean, we didn't have enough time today to explore everything that has to do with breast cancer. I think it's something that we're going to do next week, to ensure that we tackle everything that there is to know about breast cancer, because like she said, it is a very deadly disease, and she mentioned that it is the first killing disease in Cameroon among women. That means it's something you should be scared. You should be scared that it could definitely knock up on your door at any time. The ultimate thing from what I've learned today is that you should know your breasts. So we want to say a big thank you to Nurse Sonita. I mean, you've definitely taken out your time and you've explained everything that there is to know, or half of what there is to know about breast cancer. And as we wrap up today on Wellness Matters, we hope that you will be able to focus on your health more, especially when it comes to your breast health. Know your breasts, so that if anything changes over time or as time goes on, you will definitely be able to tackle it before time. And equally, the last thing, make sure you always go for checkups. Regular checkups are very, very important. And that is what wraps it up today on the Wellness Matters show. We hope that you had a great time with the music, with our guest, and of course with what we tackled today. We hope we'll be seeing you again next week to dive more into the world of breast cancer. But as for now, we're signing out. Do have a beautiful day, a beautiful week, and remember to love, live, and laugh. I remain your host, Berungwa.
JIMIT Radio 93.3